People suffering from various mental illnesses languish at the mental ward of Hargeisa Hospital. Some of the 125 patients watch television, others sleep or wander around aimlessly. Many are in chains, and the more violent patients are locked away in small cells. Such is the fate of mentally ill patients in Somaliland, an area north of Somalia on the Gulf of Aden that declared independence from Somalia in 1991. Mental illness is a widespread problem in Somaliland. Some mental health experts project that anywhere from 3 to 6% of the population could be suffering from severe forms of mental disorders. Abdirisak Mohammed Warsame is the Mental Health Program Coordinator of the General Assistance and Volunteer Organization, or GAVO. He says that, although there are no official statistics on the number of mentally ill people, surveys conducted by his and other groups paint an alarming picture.
They all shows that the level and the bulk of mental illness in the country is great, and it's very enormous. It shows that 1 to every 4 or 5 households there is mentally ill people. In some families there are 4, 3, 2 of their members who are mentally ill, 5 sometimes.
Yet, Warsome estimates that only around 550 people countrywide are receiving treatment in Somaliland's limited mental health care facilities. All lack modern drugs, personnel, and even furniture. Dr. Mustafa Hirsi is the director of Hargeisa Hospital Mental Ward. He says he thinks the healthcare system stigmatizes mentally ill patients, depriving them of proper treatment, facilities, and personnel.
Somaliland lacks a mental health policy. The mentally ill should be viewed the same way as those with other medical problems. We are only a ward in a hospital, but we should be a separate hospital.
Dr. Hirsi says the most common illnesses are obsessive-compulsive disorders, schizophrenia, post-traumatic stress disorder, and depression. Somaliland Health Ministry officials say they lack the resources to properly fund the mental health system. Health experts say the horrors of Somaliland's civil war in the 1980s are a major cause of mental illness. Another is the chewing of the kat plant, a mild narcotic that acts as a stimulant and reduces hunger. Some 80% of the male population chew kat at least once a day. Those suffering from mental illness and their families are commonly stigmatized and shunned from society. Noura Haji Mubarak's 24-year-old son Omar is a patient at Hargeisa Hospital's mental ward. She describes their experience.
Omar was stabbed by unknown assailants. Children threw stones at him, injuring his head. He threw stones back at the children. Then people beat him for that.
But people like Abdirisak Mohammed Warsame are working to combat the stigma so that the rights of the mentally ill can finally be respected. Kathy Maitani for VOA News, Hargeisa.